Hey guys, so I'm sorry that this is awful lighting. I'm sitting in my car because it's the night before I get my braces, and of course I forgot to take a video of me in daylight without my braces on. Hey guys, so this is me with my braces. I only have the top on right now. I would say I got them about 1 week ago. I got them 6 days ago, so just about 1 week ago. And I wanted to go ahead and do my first weekend, or my first month. Hi guys, so I just got my bottom braces. I realized that I haven't really mentioned my medical reasons for getting the surgery, so I wanted to go ahead and mention that. A lot has been going on as far as the surgery, so I just wanted to give you guys a quick update. So I think I've had them on for about 6 months now, and I went and visited my surgeon about a little less than a week ago, and he told me I'm ready for surgery, so I'm super excited. So I have had these ones on for 6 months, and I had the previous set on for a year and a half. So that's why I'm ready 6 months into these. So most people are going to have them on for about 2 years before they're ready for surgery. And I really have to do what's best for my health, and so I'm doing what I can do, and I'm really excited. So I don't know, I just wanted to give you guys this update. So let's take a look at the sides of my face right before I go into surgery. Hey guys, so I just went to my 2 weeks pre-op appointment, and I only need upper jaw surgery. So what they're going to do is remove my wisdom teeth along with the upper jaw surgery, and they're going to be pulling it forward 5 millimeters. So I'm really excited, and I guess I just wanted to go ahead and record one last time. I'm going to my orthodontist now, and next week I'm going in to get I had to have some screws in, but I thought I would go ahead and do some profile pictures right before my surgery. So here's my smile. And here's it to the left and to the right. Hi guys. So how long have I been here? 2 days? This is my second day in the hospital. I got my surgery yesterday at what time? Like 9 a.m. and I got out around 2 o'clock. I got home from the hospital. I stayed one night. I got discharged the next day around 1 o'clock or so. I didn't eat anything in the hospital. I didn't want their food. I mean, I had Sierra Mist and a lot of water, because the water is the most important thing as far as like being able to drink. You have to be able to drink, so make sure you can drink before you leave the hospital so you don't have trouble with it when you get home. But I ended up not using the syringe at all when I got home. I drank from water bottles. I drank from cans. As far as food goes, I would just sip soup from a mug. Applesauce, I would just use little spoons, like a kid's spoon. And then as far as like brushing and stuff like that, my mom got me a child's toothbrush. And so what I would do is, I didn't have surgery here, but I did get my wisdom teeth removed. So I would just brush real good with the rinse that I was instructed to use. I would brush here, and then I lift my lip up right here and brush. And I'm still pretty gentle, but I have to make sure I'm really brushing because I don't want to get infected. And yeah, the stitches will come out of my mouth. They're actually already starting to come out. But for me, that's how my surgery was planned. They're supposed to come out like that. So, on to something else about recovery that I experienced. I would say, double digits in the nosebleeds. I have never had nosebleeds before, so this was a crazy experience to me. I was like, what the hell's going on? But, anyway, yes, nosebleeds. I had quite a few, so to prepare for them, I would just say buy a package of washcloths. Your hospital should have washcloths for you. And as far as vomiting, I didn't vomit at all. There was the first night in the hospital that all of a sudden I got the chills really bad, and I was sweating, like really breaking a sweat, and I was over the trash can about to vomit, and I was having a nosebleed while this was all happening. And I would say that was probably the most traumatic moment I had in the hospital besides the nose plugs that got taken out of my nose, but I mean, it really wasn't that bad. I really feel like a tremendous amount of weight off my shoulders, literally, because of all the straining that my jaw was doing. So I'm really excited. I'll definitely keep you guys updated, and I should be feeling a lot better, and I'll have a lot less swelling in the next couple days. But I'm going to insert pictures so you guys can see exactly how far I've gotten. But I'll go ahead and do a side view. Hey guys, so I'm really sorry about the awful lighting, but I wanted to go ahead and make my 2 weeks post-op video. So I realized in the last one that I was on a lot of pain medicine, and I don't know, I don't think I really realized how much pain medicine I was on, and so I just want you guys to realize that that was not really fully me, and this is fully me. I'm able to drive, I'm able to communicate with people, and I know exactly what's going on. So anyway, this is my 2.5 weeks post-op. Hi guys, so I'm currently at 9 weeks. I just went to my 2-month post-op appointment and got my splint out. So I do have a lot to say about that actually. So as far as getting the splint out, I would say that was probably the most painful thing. The whole surgery, everything I went through, probably getting the splint out was the worst. And it's just because I have very sensitive gums, so basically it was 4 wires on each side of the splint, so 8 total, and he just cut the wires and then took the splint out. It was pretty quick. And then that's all basically with that appointment, but I wanted to go ahead and update you guys. Nothing has really happened. I'm not really numb anywhere. I feel pretty good. Like I've been going to work and stuff like that, so I definitely would recommend keeping your pain pills on you if you need them, but definitely don't take them if you're going to work, if you're going to drive, anything like that. Maybe just sleep at night, because and definitely wean yourself off the pills. That is the most important thing. If your doctor gives you a liquid medicine, or he gives you anything at all for pain medicine, which is what's going to happen if you're going through the surgery, you're going to want to wean yourself off of it, and the reason why is because of the side effects. So just to give you my personal side effects, the ones that I went through, I had like a lot of heat flashes, and this was because I didn't wean myself off of it. I also had a lot of nightmares, so that is, and trouble sleeping. So that's definitely because I didn't wean myself off of it, but I would recommend just taking little doses as you get yourself off of it, and definitely don't do it while you're driving, don't do it while you're at work or at school or whatever it is you're going to be doing. Make sure that it's not something you really need to function for, because the effects of hydrocodone, or whatever it is you prescribed, which most likely will be hydrocodone for a surgery like this, you're going to have to deal with talking to people no matter what. And I had a lot of family members that I talked to, and I seem to have forgotten a lot of the conversations that I had, so definitely be careful with that. Something else I wanted to mention is for those who smoke and those who drink and things like that. Drinking is not that big of an issue after the surgery, but I would wait at least 2 to 3 weeks before you start drinking anything. And as for smoking, you should wait at least a month. And the reason why I'm giving that advice is because you can get dry socket. So I had 4 wisdom teeth removed, so that was a pretty big deal as far as the dry socket. But the surgery itself as a whole, if you're just getting the surgery, whether you're getting your top jaw moved forward or your bottom jaw moved back, or you're getting the complete reverse side of that, you don't want to smoke. And the reason why is you really will, you'll ruin the whole surgery. And it's a pretty extensive, and it's just a very invasive and expensive surgery to ruin over smoking. So definitely be careful with that. I would include vape pens with that, things like that. Anything that you're going to be inhaling, you don't want to do that, and that includes straws. That's just my piece of advice to anyone getting this surgery. Just be careful with what you do. And as far as chewing, I was recommended not to chew for 2 months. So yes, I was on a liquid diet for 2 months. About 6 weeks into it, I very slowly weaned myself into chewing, and it was not recommended by my surgeon to do that. So
I am in no way giving you guys any medical advice or anything like that, just a couple tips from someone in their personal experience, but just definitely be careful with what you're doing. You don't want to have to go through the surgery again. You don't want to have to live the, effects of you didn't do something right that your surgeon told you to do or anything like that. So just be really careful with smoking, drinking, eating, whatever you're doing. Make sure that you're doing it all with caution. That's just the whole part of the surgery.